You are listening to KSG Podcast. This is a short, crisp, concise, exam-oriented, edited editorial for civil services aspirants. In this podcast, we are going to talk about measles outbreak in Mumbai. Source for the content is Rupsa Chakraborty's article for the Indian Express. Mumbai is currently witnessing an outbreak of measles. Recently, a total of 84 cases of measles have been reported in the city. Most of them are from the M East ward that covers Govandi. Now, what is measles? Measles, or as it is called, khasra, is a highly contagious viral disease which affects mostly children. It is one of the leading causes of death and disability among young children. And there is no specific treatment for measles, but there is a vaccine to stay protected from the disease, which is both safe as well as cost effective. Dr. Mangala Gomare, Executive Health Officer, says that measles spreads by coughing and sneezing, close personal contact, or direct contact with infected nasal or throat secretions, so isolation of these infected children is essential. Now, death due to measles is caused by the complications associated with the diseases like blindness, encephalitis, severe diarrhea, and pneumonia. The condition of an infected child turns severe in cases of poor nourishment, vitamin A deficiency, and if the child is immunocompromised, said Dr. Gautam Bhansali, consultant physician at Bombay Hospital. So, how long can an infected patient spread measles? As per report, an infected child with measles can spread the virus to others for about 8 days, starting 4 days before the rash appears and ending when the rash has been present for 4 days. Now, what are the symptoms? Symptoms appear around 10 to 14 days after exposure to the virus. The main symptoms are fever, dry cough, running nose, sore throat, and rash. Explaining the symptoms, Dr. Gomare says that the rashes look like small red spots which remain slightly raised and give the skin a splotchy red appearance. The face of the rash breaks out first. Within days, it spreads to the rest of the body. Now, doctors have cautioned parents to immediately contact doctors if their children show symptoms. Any delay in the detection of the infection may deteriorate the condition of the children. Now, how important is to take measles vaccines? Young children who do not receive measles immunization are at highest risks of being exposed to measles and its complications, including deaths. The WHO recommends immunization for all children with 2 doses of measles vaccine, either alone or in a measles rubella or measles mumps rubella combination. As per the guidance of National Health Mission in India, measles vaccination is given under the Universal Immunization Program at 9 to 12 months of age and the second dose at 16 to 24 months of age. Dr. Ajit Gajendra Gadkar, consultant pediatrics of PD Hinduja Hospital, says that children who are not vaccinated are at a higher risk of contracting the disease, which in some cases can be fatal or cause significant morbidity. That's it for this podcast. Thank you so much for listening. To join KSG India courses and to crack the IELTS exam, visit ksgindia.com. You can also get a PDF of this podcast on ksgindia.com. Thanks for watching.